milder compared to the primary infection because of our immune response. Yeah? Herpes simplex virus 2 is mainly causing genital herpes, and this herpes viruses lead to formation of ulcers, vesicles, which then crust and heal. And latency site for herpes simplex viruses 1 and 2 are sensory neurons. Herpes simplex virus 1 becomes latent in trigeminal ganglion, while herpes HSV2 becomes latent in sacral ganglion. Yeah, so latency sites are neurons. We have also management acyclovir. Yeah, so acyclovir is antiviral medication which blocks the DNA synthesis of the virus. We have covered also varicella zoster virus, and together with herpes simplex viruses 1 and 2, they are grouped in the subfamily of alpha herpes viruses. Yeah, and varicella zoster virus is causing chickenpox as a primary infection and shingles as reactivation. Yeah, and chickenpox is mainly childhood illness. Adults can also get infected, but really, mainly we see this in early school age children, and it leads to rash, vesicular rash. We see flu-like symptoms, also rash, and child recovers within around 10 days. Yeah, while shingles leads to epidemics and outbreaks, while shingles is common in different age group. Among elderly we see shingles, among people over 50 years of age. And this is actually reactivation of varicella zoster virus, which is latent in neurons. Yeah, dorsal root ganglion, again sensory neuron, and with the aging, going around 20-30% of people, the virus can reactivate and lead to shingles. Shingles affects not the whole body, so rash is seen along the dermatome, not covering the whole body. And rash is similar to chickenpox, so vesicles, ulcers, and then it's a crusting. And here we also see neuralgia. And usually we don't use treatment here. Acyclovir can be effective, but mainly can be used among adults because adults can develop more severe infection, and among immunocompromised we can also use immunoglobulin. Yeah. And now we're moving to the next virus, herpes virus. This is cytomegalovirus, and the name indicates a cyto cell, megalobilgia, so it leads to swelling of the cell, and similarly infected cells become enlarged and swollen. Cytomegalovirus is leading to very interesting cytopathic effect. Very briefly about history. And cytomegalovirus can lead to congenital abnormalities and also fetal death. And people were searching why fetus in the past, in the 19th century, why fetus may die, and they were observing the tissues, and they saw this kind of huge cells in lung tissue, kidneys, liver of the dead fetus. People saw enlarged cells with the nuclei similar to owl's eyes, which resembles the owl's eyes. This is cytopathic effect caused by the cytomegalovirus. And why the owl's eyes? This is the nucleus, and similarly forms inclusion bodies. Herpes simplex virus, this is also caused to formation of inclusion bodies. So these are the DNA viruses, and they replicate the genomes in the nucleus. Yeah. So, and what are the inclusion bodies? These are just can be aggregates of the viruses themselves, viral proteins, viral DNA, and as virus replicates in the nucleus, it forms inclusion bodies. Yeah, and in 19th century, people thought that as these cells are very large, they thought of protozoans, yeah, unicellular eukaryotes, and they thought that this could be a protozoan causing the disease. But of course, later then, with the advance of virology, transmission, development of transmission electron microscopy, of course, the cytomegalovirus was visualized and linked to congenital infections. Actually, people were in 1950s, people were exploring again fetal tissue. They were looking for toxoplasma. We'll cover in our course toxoplasma. Toxoplasma can also be transmitted transplacentally. This is protozoan and can lead to congenital abnormalities. And people were looking for toxoplasma, and they had discovered in the tissues of the fetus virus. Yeah, this is cytomegalovirus, showing the typical morphology of herpes viruses: nucleocapsid, tegument, and the envelope. And cytomegalovirus is considered as one of the most successful human pathogens, like other herpes viruses. CMV cytomegalovirus is also very successful. Successful, what does it mean? It infects the huge portion of the human population worldwide. So, and in underdeveloped countries, around 70%, in developed countries, around 70% of human population is infected with CMV. In underdeveloped countries, even more, over 90%. And cytomegalovirus has various routes of transmission. Let me remind you that herpes simplex viruses are transmitted through saliva mainly, and also through sexual intercourse. Varicella zoster virus is mainly transmitted through respiratory droplets and also through vesicular fluid. Yeah, through direct contact. And but CMV, cytomegalovirus, is transmitted through different ways, through saliva, through sexual intercourse, from mother to child, also through blood transfusions, transplantations. Yes. Yeah, so perhaps students can explain what's vertical transmission and what's horizontal transmission. Yes? Yeah. Yes, exactly. Horizontal is from one person to another, either through respiratory droplets or whatever, but vertical transmission is from mother to child, from one generation to another. Thank you. So it is very widespread virus, and which disease is, firstly, as it is spread through different ways, cytomegalovirus can infect various tissues and organs, so it has wide tropism. It can be found in lymphocytes, esophagus, kidneys, TNB lymphocytes, liver, lung, can cause hepatitis in some patients, and the latent state is in a myeloid cells, and so virus can reactivate time after time, but in healthy people it's not an issue, reactivation, but can be problem among immune suppressed. Yeah? So once we are infected, we carry this virus lifelong. Which diseases are caused by cytomegalovirus? The most the most important diseases are congenital infections with the cytomegalovirus. I will talk a bit more on the following slides. And infections with immunosuppressed individuals and allograft and people with allograft transplantations. Here, the cytomegalovirus can be deadly in those cases. For fetus, it is very dangerous. It can lead to significant abnormalities and also to fetal death. And among immunosuppressed individuals can lead to systemic infections and can lead to pneumonitis, retinitis, colitis, encephalopathies in allograft transplantations. Also in transplant patients we see transplant patients are immunosuppressed, so they're getting immunosuppressive medications, so cytomegalovirus can reactivate there and can lead to rejection of the transplanted organ and also can lead to other systemic manifestations. We'll discuss in tutorial one case regarding this issue with transplant patients and CMV infection. So cytomegalovirus infection became more common because of systemic infections with cytomegalovirus. With more transplantations starting from 1990s. We are using wide chemotherapy and wide use of immunosuppressive medications leads to reactivation of cytomegalovirus infections, and in institutions performing transplantations they have special department dealing with special people dealing with the cytomegalovirus infections. So these two are the most important: congenital infections and infections in allograft transplantations in patients with transplants and also in immunosuppressed individuals. So their CMV can be deadly, but what is the most common clinical manifestation with cytomegalovirus? This is cytomegalovirus mononucleosis. Majority of infections are asymptomatic. So we might get cytomegalovirus but not be aware of it, and we may not have any clinical manifestation. But some infected individuals develop cytomegalovirus mononucleosis. Infectious mononucleosis is a disease which can be caused by different viruses. The most commonly Epstein virus is causing infectious mononucleosis. Next virus to be discussed today. So around 80-85% of infectious mononucleosis cases are caused by Epstein virus, and around 15-20% are caused by cytomegalovirus. But similar symptoms can be seen with HIV infection in the first phase of infection, also with Toxoplasma gondii infection. This is protozoan infection as well. So what we see, what are the signs and symptoms in patients with infectious mononucleosis? Here is a fever, can be also sore throat, hepatosplenomegaly, lymphadenopathy, and can be rash in some patients. And it is self-limited disease, so people recover within 2 weeks, 4 weeks. Fatigue can last longer. Reactivation reinfections are possible. Reactivations are not an issue among healthy people. Yeah. So congenital infections, very important. Actually, 1 of 100 babies born. The statistics is more for developed countries, so we have more accurate, better statistics. So 1 out of 100 babies born in developed countries has cytomegalovirus infection. So congenital infections are quite common, and rubella virus will cover in paramyxoviruses section chapter. Rubella virus is also causing severe congenital infections, but nowadays we have vaccine, and this infection is prevented. So nowadays mainly the cytomegalovirus is causing congenital infections and abnormalities and some developmental issues, not only developmental but other issues in babies. And as you see, this is the statistics. When there's a primary infection of mother during pregnancy, risk of transmission is higher. Primary infection, you see, 20 to 40%. And if it's reactivation, quite low, up to 2.2, because as I was describing this last week, in reactivations, viral load is lower, because we already have immune response, which switches on in a short time after viral reactivation and limits the viral replication. So therefore, transmission to fetus is very low in reactivations and quite high in primary infections. And 5 to 10% of infected babies develop clinical manifestation. You see growth restriction, they have eye infection and eye pathologies, retinitis, jaundice due to hepatitis, microcephaly, so the head is a smaller, hepatosplenomegaly, so because of hepatitis and enlargement of spleen. And among symptomatic babies, up to 80% can develop mental retardation, deafness, and blindness, and we see death in 20%. While in reactivation, when there's a reactivation and transmission to fetus, majority of cases are asymptomatic. So fetus doesn't develop, so risk is lower, of course, compared to the primary infection. And if we see late sequelae, there can be deafness and some learning deficiencies. And yes. So consequences that we see signs and symptoms at birth. I will show you the image of the next one. Late sequelae means that we see this manifestation later, not at birth, but we see that deafness can be detected later, for example, not at birth, and also learning deficiencies. Late consequences of congenital infection, which, sorry? How late? So learning can be several months later, can be years later, so late sequelae is like this, And babies born symptomatic, babies born with cytomegalovirus infection, disease name is cytomegalic inclusion disease, can show this blueberry muffin patches on the skin, so these are hemorrhagic patches, purpuric lesions. This we might see with rubella infection as well, but as I have mentioned, rubella infections are quite rare now, and so microcephaly, seizures, deafness, jaundice, purpura. And of course, these congenital abnormalities and pathologies are seen more if the baby is infected in the first trimester, then the risk is decreasing. Yes, so this is usually so with the viral infections, viral congenital infections. Laboratory diagnosis is so how we do. Yeah, so we can use serology to detect. Serology means that we detect antibodies in serum of the patient. IgM indicates recent infection, and IgG is past infection. We also can use PCR. We can take biopsy specimens and observe these owl's eyes cells. Yeah, like this, owl's eyes. These are two cells fused, so you see two nuclei and owl's eye appearance. So if in MCQ, in the description, you have that histopathology shows owl's eye cells resembling owl's eyes, remember this is cytomegalovirus, yeah? Like slapstick, parvovirus B19, swimming pool source adenovirus. Yeah, so cytomegalovirus, owl's eyes. Okay, please remember. Yes. Yes. So, virus can be isolated. Usually herpes viruses are culturable, but for diagnosis purposes, as we have new techniques, rapid techniques for detection like PCR or serology, virus isolation is no longer commonly done. Yeah? Because it needs time for the virus to grow. So, and also here we have treatment. We can treat cytomegalovirus in patient, but we cannot cure again. Yes, similar to herpes simplex viruses and varicella zoster virus. Here we have ganciclovir, ganciclovir. They have similar mechanism of action, similar to acyclovir. So they block viral DNA synthesis. Cyclovir also does the same. Foscarnet are alternatives, but they have side effects. That's why first the ganciclovir or the ganciclovir are used. But if there is a resistance, then cyclovir and foscarnet can be used. Yeah. And if there is these antivirals are given to transplant patients, immunosuppressed individuals in congenital infections, we use these antivirals. So far, there is no available vaccine for cytomegalovirus. Now, next virus, Epstein-Barr virus, also very commonly distributed and similar to other herpes viruses. So majority of humans have this virus, and virus is transmitted mainly through saliva. Yeah, so mainly through saliva, through sharing of some personal items, drinks. Yeah, so and there are two peaks of transmission. In underdeveloped countries, very often children are infected, through saliva because of poor sanitary conditions. But in developed countries, mainly we see infection among young adults, among college students. So this is the main age group which gets infected. So with Epstein-Barr virus. And the disease which is caused by the Epstein-Barr virus is named kissing disease because it is transmitted through saliva. It causes infectious mononucleosis, as mentioned. And Epstein-Barr virus infects mainly two types of cells, epithelial cells and B lymphocytes, and it becomes dormant, so latent in B lymphocytes, and can reactivate time after time. Majority of infections are asymptomatic. But in some patients we see clinical manifestation, and this is infectious mononucleosis. With similar signs and symptoms I have described for cytomegalovirus. So incubation period can be up to around 4 weeks, can be a bit longer, and then patient experiences this fever, sore throat, lymphadenopathy, hepatosplenomegaly, can be rash as well. I know one person who described to me Epstein-Barr virus infection when he was a college student, university student. He experienced this infectious mononucleosis, and he was describing that I was thinking that I would die soon. I had such a fatigue, I was so weak. I went to doctor, and he said, don't worry, this is a self-limiting infection and it will go away. But I didn't believe the doctor that I would survive this. So this fatigue it is self-limited disease, but this fatigue can last for several weeks and can interfere with everyday life activities. And it causes hepatitis. That's why there can be hepatosplenomegaly. And one should avoid contact sports because there is a spleen enlargement, and the risk can be the splenic rupture. There can be also pharyngeal obstruction because of infection of epithelial cells there, and very rare complication can be meningoencephalitis. Diagnostic tests can differentiate if the person has cytomegalovirus or Epstein-Barr virus when they show the signs and symptoms of infectious mononucleosis. I also remember two cases when one daughter of my colleague was having prolonged fever, and we suspected that it was infectious mononucleosis. So she had first the flu-like symptoms, and for several weeks then fever, and mother was worried, and so we microbiologists thought that it should be Epstein-Barr, and then she made a test, and it was Epstein-Barr virus. And so it can lead to, first the person can have this fever, sore throat, and low-grade fever for a long time, so for several weeks, 37.34, so it happens often. And what is interesting that we can differentiate cytomegalovirus infection from EBV by monotest. monotest detects heterophil antibodies. So our B lymphocytes, in response to Epstein-Barr virus infection, produces heterophil antibodies, which does not show high specificity, and heterophil antibodies can interact with various hetero means several feel to love like, yeah, so heterophil antibodies can bind to different types of antigens, including horse and sheep red blood cells, and this ability is used in a test. This is monospot test, so these heterophil antibodies can agglutinate red blood cells, sheep red blood cells, and this is a monospot test. So if infectious mononucleosis is suspected, this simple monospot test can be used to see if it's CMV infection or EBV. If monospot test is positive, it means that heterophil antibodies are produced and it is Epstein-Barr virus infection. Of course, we can do also PCR, we can detect specific antibodies to Epstein-Barr virus, and we can also detect viral antigens. So these are also diagnostic tests. And in Epstein-Barr virus infection, we see atypical lymphocytes, which are activated lymphocytes, and they show they are bigger, they are swollen, and they have more cytoplasm compared to the normal lymphocytes and enlarged nucleus. Yeah, these atypical lymphocytes are produced in response to various infections, but we see more in Epstein-Barr virus infection. Yes, please. So if atypical lymphocytes are checked, micrographs, what do you mean? I don't understand. For all viruses, you mean? No, if there's a suspect that the virus is causing some histopathological, so cytopathic effect, we can check. Yeah, but quite often histology is done. Biopsy specimen. Sorry. Yes, there will be you mean images, micrographs. In a few, maybe yes, but not in the. So your question is. No, of course not. Some, yeah, very distinct ones maybe. In midterms, I don't remember that there were micrographs. In final, just one or two, but mainly from parasitology. But the CMV, cytomegalovirus, is so causes so distinct cytopathic effect that very often this image can be there. Yeah, so owl's eyes. But not usually not. We will not have this in midterms and finals. Yeah. So atypical lymphocytes, no. Okay. So Epstein-Barr virus can cause cancers. Yeah, so we're covering the viruses which can lead to cancers. Epstein-Barr virus can lead to lymphoproliferative diseases, lymphomas, leukemias. It infects the B lymphocytes, yeah, and becomes latent there. And if the patient is immune suppressed, the patient has problems to limit viral replication, so CBAs cannot properly detect viral infected B lymphocytes, and Epstein-Barr virus leads to immortalization of the B lymphocytes. As I have mentioned, DNA viruses push the host cells to S phase. Yeah, they weren't actively dividing cells, so Epstein-Barr virus does this as well. So it can push to B lymphocytes to divide. And if patient is immunosuppressed, this patient is under risk to develop lymphomas and leukemias, B-cell lymphomas, non-Hodgkin's lymphomas. Also, Epstein-Barr virus can lead to Burkitt's lymphoma, and this can be an endemic form of Burkitt's lymphoma. Is common in Africa, especially among children, and it can affect jaw, as you see here, but it responds to chemotherapy favorably, so we can treat this cancer. We cannot treat the Epstein-Barr virus. There's no treatment for Epstein-Barr virus, but we use chemotherapy against the cancer, and it is actually treatable, especially if the treatment starts early. And in Burkitt's lymphoma tissues, we see all the time ABV antigens, Epstein-Barr virus genome and antigens, and actually Epstein-Barr virus. So Burkitt's lymphoma results from chromosomal translocation and overexpression of MYC gene. So I will not go in detail, okay? And Epstein-Barr virus also contributes to overexpression of MYC gene. So, as Epstein-Barr virus infects epithelial cells as well, so B cells, main targets are B cells and epithelial cells, we see B cell cancer, so B cell lymphomas, and we can see also carcinomas. So nasopharyngeal carcinoma, so epithelial cells are affected in this case, and where the cancer is formed is in nasopharynx, and it can spread to different parts. It can spread to brain as well, and this cancer is endemic in specific geographic areas like China, also in Malaysia, Alaska, Iceland. So genetic factors as well as environmental and geographic factors play a role in development of cancer, similar to Burkitt's lymphoma as well. So in Africa is endemic form, and malaria plays important role, can be considered as a cofactor in development of Burkitt's lymphoma. And nasopharyngeal carcinoma is treated using radiotherapy, and also, so when the therapy starts early, it is also treatable. Nasopharyngeal carcinoma. In HIV patients, this is a tongue, and you see this whitish layer formed on this on the sides of the tongue. This is whitish, more whitish than yellowish, and again infection of epithelial cells by Epstein-Barr virus. This is reactivation of Epstein-Barr virus in immune suppressed individuals, and this is on tongue. And the last herpes viruses to cover today. Today I want to cover pox viruses as well, and I will try to go through these viruses very briefly. Human herpes viruses 6, 7, and 8. Herpes viruses 6 and 7 are also very common. Over 90% of individuals are infected with these viruses. More studies is better studied viruses, human herpes virus 6, and it is mainly transmitted through saliva, and we get infected in early childhood, and then virus becomes latent in our body. So which is the most common clinical manifestation. This is Roseola infantum. So we now are covering the next childhood illness with the rash, and this disease is common among children from 4 months to 2 years of age. And first the disease starts with the fever, very high fever. It can lead to convulsions as well, seizures, and patients may require hospitalization. Very rarely it can lead to encephalitis, and when the fever subsides, child develops this kind of maculopapular rash. Yeah, not vesicular, but maculopapular, this red small spots, on the body, and then it goes away. This rash can last for several hours to a few days, 2 or 3 days, and then goes away. Yeah, it is not a vesicular rash. So here first we have high fever, then fever subsides and the rash develops. If adults get infection, primary infection with HHV6, they develop infectious mononucleosis-like disease. So there's no treatment, no vaccine. Diagnostic can be, as usual, PCR or serology. And the last herpes virus to discuss, this is human herpes virus 8, also leading to cancer. It leads to Kaposi sarcoma. This is cancer of endothelial cells of the blood vessels, and this human herpes virus 8 is not as common as other herpes viruses. Depending on geographic region, we might see different prevalence. For example, in European countries, I think, as I remember, it can range from 15 to 30%. In African countries, from 50 to 80%. In some countries, just from 8 to 15%. So it is not as widely distributed as other herpes viruses. And Kaposi sarcoma, this cancer, became more clear, more common with the appearance of HIV. Yes, so because HIV leads to immunodeficiency, and Kaposi sarcoma was very commonly seen among HIV patients, and it leads to development of such bluish, purplish patches on the skin. Yes, so this is actually cancer of endothelial cells of blood vessels, and can be seen in visceral organs as well. Yeah, and it can be severe and deadly as well. So that's all for herpes viruses. This is chapter 33 from James Melnick's Medical Microbiology. And so we have covered viruses here which cause cancers in humans. Yeah, so Epstein-Barr virus and human herpes virus 8. Yeah, so important viruses. Now we can have a break for 10 minutes, and we start with pox viruses. Yeah, next chapter. Okay, let's continue. Are you ready to start a new topic? Pox viruses. It's quite a short chapter in your textbooks, especially in Levinson, so please read from Javeselnik's Medical Microbiology. And I have, in the last semesters, I had just one slide on monkeypox. For this semester, I have increased, so I am providing more information. And mainly I got data from WHO site. Yeah, so on monkeypox I'm providing the data because in your textbook is just a very short information. Okay, pox viruses are very unique. Why they are so unique? Do you remember that pox viruses are the hugest among human pathogenic viruses? In the first lecture I have discussed the sizes of the viruses, and the smallest was the parvovirus and the largest was the pox virus. So pox viruses can be observed under the light microscope as well. They can reach 400 nanometers, and they are brick-shaped like this or oval-shaped. Yeah, and they have these protrusions like glycoprotein protrusions on the surface, and they are very, so one unique property, they are largest. Another unique property, they have very strange shape, brick-shaped, or they are ovoid. And they're DNA viruses. They have double-stranded DNA, and they have very huge DNA encoding all the enzymes which are needed for viral replication. Yeah, so as this virus doesn't need to go to nucleus. Yeah, do you remember all DNA viruses go to nucleus? That exception is a pox virus. Yeah, they don't need. And they have this double envelope glycoproteins. This is a core, central nucleocapsid, which contains the double-stranded DNA and enzymes for transcription. Yeah, so when virus enters the cell in the cytoplasm, it should transcribe the genes, so it provides transcription enzymes. And it has also some nuclear lateral bodies here, and the lateral bodies contain many proteins, and it's difficult to study, it's difficult to isolate each protein, and therefore the function of lateral bodies are still not well understood, but several proteins are studied, and proteins from lateral bodies participate in modulation of the immune response. They're also involved in transcription as well. But the studies will reveal more and more, of course, about the function of lateral bodies. So, pox viruses have the largest genome among human and animal viruses, and replication takes place in the cytoplasm. Yeah? So, first step, we know what is the first step. Yeah, attachment to the specific receptors. Then is the fusion of viral envelope with the plasma membrane and viral core containing viral DNA. Also transcription enzymes for transcription, and also capsid proteins. Core consists of these components, and you know that DNA viruses have early and late stages of gene expression, transcription, and translation. And in early transcription, virus synthesizes the early messenger RNA, early enzymes, and early virion proteins. And actually, virus needs to uncode, yeah? And uncoding of poxviruses has two stages. In the first stage, the cellular proteases partly uncode the virus, but then after partial encoding, early transcription, early translation is initiated, and among early proteins, virus encodes its own uncodase, yeah? And uncodase completely uncodes the virus, and so viral DNA is released. Among early enzymes, you might remember that viruses also produce enzymes for DNA synthesis. So pox virus produces all enzymes for DNA synthesis, and DNA replication is initiated. When enough DNA is synthesized, then late transcription starts, late messenger RNA, late enzymes, late virion proteins, and which of these late proteins? Structural proteins. Yes, so viral nucleocapsid assembles. Late enzymes are transcriptional enzymes which are found in the virion, and actually pox viruses but from cytoplasmic membranes like transplant network membranes, and they acquire two envelopes. They have two membranes, and they are released through exocytosis from the cell. Yeah, can be also cell lysis and also exocytosis. There are various pox viruses. So don't afraid of this slide. I will not ask you to memorize all this information that is given here, but this is to illustrate that pox viruses have developed the strategies very effective strategies to modify their immune response. Do you remember when we were covering pathogenesis lecture, we have covered briefly how viruses can evade the immune response, and viruses produce virokines or viroreceptors, so cytokine analogs or cytokine receptor analogs. Yeah, and this is true for pox viruses, so they can encode a huge variety of such micromolecules, and they can interfere with the immune response, and they can modulate the immune response. Yeah, so they have also several strategies to block interferon response, also to block inflammatory reactions by producing interleukin-1 receptors. So they have huge genomes, and they encode a lot of up to 200 or even more proteins. So, which are the most important pox viruses? In the past, the most important was smallpox virus, but nowadays it is eradicated. We don't have smallpox infections, but we are still covering smallpox because it is considered as a bioterrorist agent. Yeah, so potentially this virus exists. Officially, this virus is kept in two countries, in USA and in Russia, but can be kept by other countries, and there's a risk of bioterrorist attacks with that smallpox, so this virus may re-emerge. Can be a deliberate release of these viruses, so we still cover smallpox, signs and symptoms, pathogenesis, and what we can do with this virus, how we can treat. And smallpox was probably transmitted from animals many years ago, probably 10,000 or more, even longer, even before that. And actually, this historically well-known disease, its mortality rate can reach up to 30%, and the oldest victim is Ramses V, who died from the smallpox. And it was possible to see smallpox lesions on the skin of the mummy, and it had worldwide distribution. We see in the we see stories from China, other Asian countries, in Europe. So it was devastating infection, and mortality rate could reach up to 60%. And you might know that smallpox is leaving the scars, and people were disfigured, or the virus affects the eyes as well, and it was leading to blindness as well. In infants, case fatality rate could reach even up to 100%. And what is interesting that actually first vaccine developed was the smallpox vaccine. You might know this story with Edward Jenner. Edward Jenner was the guy who first developed the vaccine, and it was smallpox vaccine. But before development of Jenner's smallpox vaccine, in India, in other Asian countries, people were practicing variolation. They already had the observation that people were not getting smallpox for the second time, so they were taking material from the patient having the mild clinical manifestation, and they were introducing this, so either through scarring or through nostrils among the healthy people, and they got protection, but it was quite risky. It was leading. Mortality rate was 1% with variolation, but it's still better than 30% or 60% with the smallpox, what we see with the smallpox virus. Yeah? And variolation was, I'm not going to the detail as we're short in time, so variolation was first introduced then from Asia into Europe, and then Edward Jenner developed the first smallpox vaccine. I think this is from a school book, this story that Edward Jenner observed that milkmaids were not infected with the smallpox virus, but he saw that milkmaids were developing some skin lesions on the hands, and they were getting this infection from the cows. Yes, so cows on the skin had these vesicles. And Edward Jenner introduced, actually made a challenge experiment on his gardener's son. So experiment directly on human. Yeah, so he took some material from the cow skin material, of course infected cow, and that has done variolation on the skin of this boy, and then he infected after 2 weeks. Luckily, after 2 or 3 weeks, he infected this boy with the smallpox, but this boy didn't develop the disease. And starting from then, people started, so production of vaccine was initiated, and the vaccine was obtained from calf cows, so the skin was damaged and the virus was introduced, so lines were made on cows. Till 1980s and 70s, the virus was made this way. Yeah, but nowadays we have new vaccines. I will talk about this. So in 70s as well, cows were used to get the vaccine, and each cow was producing 4,000 doses of vaccine. And the name vaccine comes from vacca. Vacca from Latin is cow. Yeah, so yes, this is how people were getting the material for vaccination. And WHO initiated the worldwide campaign for smallpox eradication, and in the 1980s smallpox was considered eradicated. So nowadays we don't have smallpox. And why it was successful? We have vaccines for various viruses. Why eradication is not achieved? There were no asymptomatic infections with smallpox, so all diseased people were showing the symptoms, so it was possible to identify and isolate the patients. Vaccine was easily available, it was stable, there was no animal reservoir, only humans are infected with the smallpox, and vaccinated people were easily identifiable as well because the vaccine leaves the scar on their arm. Yeah? And so this is one of the hugest achievements of World Health Care Campaign. So, how smallpox is transmitted? Through inhalation of droplets, direct contact, so the person develops this pustule and vesicular rash, similar to chickenpox. Yeah? So respiratory droplets through contact, also through contact with the items used by the patient, so bedding, clothing, bandages. And the smallpox was one of the first viruses used as a bioweapon when there's such story when British went to America and they were fighting Native Americans. But there was no smallpox on that continent, and so British army forces took some clothing of dead people, people having smallpox, and gave the presents to poor Native Americans, and more people died there due to smallpox than from the actual fight and war with the army. Yeah? So smallpox was devastating. So when smallpox is inhaled, virus is inhaled, it first replicates in the upper respiratory tract, and in fact similar to chickenpox, varicose-zoster virus. Yeah, so firstly it goes through inhalation the respiratory tract. We have local replication, local lymph nodes are infected, macrophages get infected, then the virus moves to the blood. We see primary viremia. Through this viremia means that virus is in the blood. Yeah, so and through blood virus travels to different organs, liver, spleen, so multiple organs, replicates there, and again and distant lymph nodes are also involved, and then virus re-enters the blood circulation. This is secondary viremia, and then virus reaches the skin and leads to development of specific rash. Firstly, as with other viral infections, we have prodrome phase with constitutional symptoms like fever, headache, can be vomiting, can be bodily aches, backache, and then rash starts to develop. And first some lesions are seen in the mouth, and then skin lesions start to develop. And the patient is most contagious with the rash, and stays contagious until the last scab falls off. Yeah? Incubation period around 14 days, and when the red spots appear in the mouth, patient is very, very contagious. Yeah, when it is talking or sneezing, coughing, lots of viruses are shed, and the virus is spread through respiratory route. and then the rash starts to appear on face and then spreads on other parts of the body, and we see more skin lesions on extremities than compared to the trunk. In chickenpox, we see more skin lesions on the trunk than on extremities, but here is other way round. Yeah. And skin lesions look like, so this is pre-eruption, the incubation period, first the papules and vesicles appear, then they turn into the pustules, so when these vesicles are filled with the pus, and then it forms the scab, and this duration of illness can be 2 weeks, 4 weeks, like this, so much longer than the chickenpox. Yeah, and the patient is contagious, most contagious during the rash. There are 2 strains of smallpox, variola minor. Another name for the smallpox is variola. Yeah, or variola. And variola minor and major and minor, there are 2 strains. Variola major was causing the majority of infections and was the most severe with the rash, with severe rash and with high mortality rate. Variola minor was less common with milder rash, and mortality rate with variola minor was just 1%, just similar to variolation. So this is the skin rash, most common with variola major, and these pustules are separate, and this is the most common manifestation. Semi-confluent, when these lesions start to coalesce, so, and there's a confluent, more severe form. Variola minor, in variola minor we see less skin lesions, and clinical manifestation is milder. And if we compare smallpox with chickenpox, what differences we might see? So in smallpox, fever starts 2-4 days before the rash, but in chickenpox, the fever starts and we already see lesions starting to appear on the face, for example, and then more and more skin lesions appear. And in smallpox, skin lesions are at the same stage of development. Yeah, so all are vesicular, all are pustular, and then all skin lesions move to the scab stage. But in chickenpox, these skin lesions are under different stages of development. Some skin lesions are just appearing, others are already pustular, and so we see this difference. Development of the disease is slow. In chickenpox it is more rapid, and we see difference in distribution. In chickenpox more skin lesions are on the body, while in smallpox more skin lesions on arms and legs, and usually on palms and soles we see these pox, with the smallpox. In chickenpox, rarely, usually absent, but we still can see a few. And mortality rate can be more than 10% with smallpox, while it is quite rare with the chickenpox. You see, this is a smallpox. In chickenpox, no lesions on palms and soles. And this is the typical smallpox rash. So how can we identify? Of course, PCR, or we can detect viral antigens. Also, we can take the skin lesion material and observe under the microscope, and if we see brick-shaped huge viruses, we can suspect that it's a smallpox. Virus isolation is possible, and culturing under laboratory conditions. Antibody test is not specific because many pox viruses like Smallpox, monkeypox, cowpox viruses are antigenically very related, so antibodies may cross-react. So antibody test is not specific, yeah, for smallpox virus. And treatment and prevention. So in prevention we have vaccine, we use vaccine, and we should isolate patient, and supportive therapy to give fluids, fever reducers, and nowadays we have 2 medications approved by FDA, tecovirimat and Vaccinia was just recently. These 2 medications were approved just recently by FDA, and Vaccinia blocks viral DNA synthesis, while tecovirimat blocks maturation of the virus particles, so virus cannot form proper envelope and cannot be released from the cell. Yes, so these are the recently approved antivirals. And there's a very effective vaccine from Edward Jenner's time, and you might be surprised, but it's not an attenuated smallpox virus. It's totally different virus. It's a Vaccinia. So Edward Jenner initially was using cowpox virus, for vaccination. He was getting this from cows, but nobody knows at what stage of vaccine production totally new virus appeared, and the name of the virus is Vaccinia Virus. And people think that it's a recombinant of cowpox and smallpox, or it's a already extinct horsepox virus, so nobody knows how it appeared. But the fact is that in vaccine nowadays, Vaccinia virus, so this is different. It's not a smallpox virus. There will be questions, in finals. So what type of vaccine is for smallpox? And very often students get confused and say that it's an attenuated smallpox virus. No, it's a Vaccinia virus, It's a live vaccine, and it is introduced by scarring the skin, yes. Through sequencing and through comparison of genetic. Because the virus, horsepox virus is extinct, doesn't exist, for example. But Vaccinia relates genetically to cowpox and also to smallpox. That's why one theory says that this can be recombinant. Usually pox viruses are under one genus, orthopox virus genus. They are quite related to each other, antigenically, also genetically, and these theories are based on genetic studies, of course, and the virus is sequenced. But when did it appear during vaccine production? Nobody knows, so probably there was a contamination with smallpox or horsepox virus, and after, so the virus is introduced through scarring, and we see such development of vesicle first. Yes, you see here, then pustule starts to dry out, and then scabs are formed, and then it leaves the scar. So this vaccine was classically obtained from cows, but of course people didn't want to have vaccine obtained through old-fashioned techniques, and as there's a threat of bioterrorism, it's important to have vaccine stocks, and 2 vaccines were developed. ECM 2000 it is also live Vaccinia virus, but obtained, grown in cell culture, not in cows, yeah, but cell culture. And usually vaccination with the Vaccinia virus can lead to some complications. It's a live virus, not attenuated, and cannot be given to immunosuppressed, cannot be given to pregnant ladies, and it can lead to systemic infections and some complications. Yeah, so ACAM 2000 is this kind of vaccine, and risk exists of serious adverse events. It is administered as a single dose, yeah? So skin is damaged. And just in recent years, I think in 2019, Genius new vaccine was developed, and this is replication incompetent Vaccinia virus. So this virus is alive but is not able to replicate in humans. Yeah, it is grown in chick embryos, and many passages were made to attenuate this virus. And finally, this replication incompetent virus was obtained and used in vaccines. So the virus has ability to replicate in chick embryos, but no ability to replicate in humans. Yeah, this is modern one. Yes. Take occurs means that vaccinated person can spread the virus. With the live Vaccinia, yes, you can spread the virus to contacts. Yeah, but with replication incompetent virus, you cannot spread the virus. Yeah, this is the difference. Yeah. No risk of autoinoculation means that when you are vaccinated with the live Vaccinia virus, you can just scratch the air and then put the hand in the eye, for example. And this is autoinoculation, or you can spread the virus to other part of the body, other areas of the skin. This is autoinoculation. This is possible with ACAM 2000, but not possible with Genius. So Genius is new vaccine, more modern, more safe, and this is given subcutaneously, 2 doses with 28 days apart. Yeah, so this is a modern vaccine, and these 2 vaccines can be used to prevent and are used to prevent monkeypox. Yeah, so this I have told you already. Who should not get the vaccine, but the live one. Yeah, Genius can be taken by people who have weakened immune system, and yeah. Okay. Now, as smallpox is eradicated, now monkeypox appears to be the most important pox virus nowadays. So, what do you know about monkeypox? Maybe you have read some news, some information about monkeypox. No? I was asking if you know some information about monkeypox, as it is became very popular now, yeah, in the last months. Yeah, so patients develop skin lesions, yes. Recent outbreak is, recent outbreak. No, don't worry, that's fine. So, monkeypox, we had recent outbreaks. Sorry? Yeah, can be. There's still studies ongoing. Droplets and skin contact. Yeah. Yes, and among gays and bisexual men, the transmission is higher with monkeypox. Yeah, so we have heard already some information. Yeah, so briefly, history. So this our outbreak is still ongoing. Yeah. Actually, it is similar to pandemic. We have worldwide spread with monkeypox, and monkeypox was endemic in Africa. Yeah, so in west and central parts of Africa, and first it was discovered in 1958 in lab monkeys in Denmark. Yeah, that's why the name monkeypox. Are you tired? No, some people are not listening. So, anything to discuss? Girls, are you looking, are you searching some information on monkeypox? Do you want to share with us? Okay, I'll continue, yeah? So, in 1958 was the date when the monkeypox was discovered, and it was discovered in monkeys. That's why the name monkeypox. But the first cases in humans was were found, was documented in 1970s in Africa, in Democratic Republic of Congo. Children got infected, yes? At the same time, you mean? So... Yes. Yeah, very good point. Yeah, yes, HIV was transmitted from monkeys, yes, definitely. But what's the difference here? Reservoir for monkeypox is not monkey, but rodents. It's a wrong name. Monkeys can get infection, but main reservoirs are rodents. Yeah, but in HIV. Actually, HIV came from simian immunodeficiency virus. We'll cover this. Yeah, it's IV. So this originated from monkeys, but humans get infected usually with monkeypox from rodents or from another humans. And regarding the time, HIV first was transmitted to humans in the beginning of 20th century several times, but monkeypox was first described in 70s, but probably prior that was transmissions as well. There were cases, but not documented. Yeah, so totally, I think they have totally different histories, as the reservoir is different, and route of transmission is also different. Yeah. Because why new viruses are emerging, yeah? So animal trade, strains are changing, mutations, worldwide trade, tourism, yeah, all this contributes to spreading of new viruses, yeah? So, but monkeypox is not very so of concern. We'll see just in a minute. Yeah, so endemic countries are in Africa, West and Central African countries, as you see here. And there are two strains of the virus, West African strain and Central African strain, and Western African strain is spread now, and this Western African strain is milder with lower mortality rate. Central African strain leads to mortality. Usually mortality can be around 11-15%, but with this outbreak that we have now, mortality reaches maximum, I think, 2%, but usually 0.04. Yes, so mortality is quite low. And this is just recent statistics. Nowadays, this is what we see in many countries. In Georgia, there were 2 cases of monkeypox, but many cases were registered in US, also South America, Brazil, you see in European countries, and in total over 70,000 cases and 26 total deaths. Yes, so mortality rate is quite low. And this is what I was checking yesterday, the new data, and so the cases are decreasing. Yeah, so it started from May, then reached the peak in August, and now cases are declining. And why? What do you think? Why cases are declining? Vaccination, yeah, very good point. So in areas with high prevalence, people got vaccines, yes? Yeah, these are the 2 major points. So awareness, so people now are aware how virus is transmitted, and they're more cautious, and so they take this information into consideration. Yeah, so especially men having sex with men. Yeah, so highest prevalence was there among this population, but it is how it is transmitted we'll see just in a second. So it is zoonotic, so this is animal infection. It is transmitted from animal to animal, from animal to human, and human to human. So it is transmitted through respiratory droplets, also through direct contact, long, close contact. Yeah, it is less contagious compared. Coronavirus is totally different virus, but if we compare, both are of concern nowadays. Yeah, so our reproductive number for coronavirus is, so one person, how many persons people can be infected from infected individual. Yeah, this is our number. For measles virus it's 15. Measles virus is very contagious. For corona it was 2.5, but for monkeypox it's from 0 to 1. Yeah, so less than one person can get infected. Yeah, so, and this is another reason why these cases are declining. Yeah. It can be transmitted also transplacentally from mother to child and can lead to congenital infections. And now more studies are needed because that can be transmitted if the virus can be transmitted through sexual route. Yes, so studies are ongoing. Yeah, so but in semen the virus was detected. Yes, so in semen the virus is present, so but still studies are needed. Yes, so how many viruses are there, and if a transmission can occur through that way. Yeah, signs and symptoms. Incubation period. So actually pathogenesis is similar to smallpox. So you inhale the local replication, then virus spreads through blood to multiple organs, then there is a secondary viremia, virus reaches the skin and gives rise to these skin lesions. Skin lesions are similar to smallpox lesions, and the and we have 2 phases, 2 periods in clinical manifestation. Firstly, again, this prodromal phase, where we see fever, headache, backache, vomiting, and what is the, remember this, so monkeypox resembles smallpox, but it's milder, and lymphadenopathy is the difference. In smallpox, we don't see lymphadenopathy. In monkeypox, we do. In chickenpox also, we don't see lymphadenopathy. So well expressed, so well clinically seen lymphadenopathy, enlargement of the lymph nodes. But in monkeypox, yes, we do see this. So this information I took from WHO site. Yeah, very good information is given, and this information is reliable. You cannot use any information from internet. Yeah, the CDC, WHO, or peer-reviewed publications. In second phase, we see this is eruption period. Yeah, so when the people will show rash, and similar to smallpox, the rash concentrates on the face, extremities, rather than on trach. Yeah, and this is a typical rash. And actually, smallpox and monkeypox rash, the skin lesions can be umbilicated. This is not working. Umbilicated, and these skin lesions can be a few, can be thousands. Yeah, so it is rather so different individuals may show different manifestations. Treatment, rising awareness, supportive treatment and prevention, rising awareness, supportive care. Yeah, so again, as we saw, what we saw with smallpox, vaccination with the smallpox vaccines, because the viruses are very closely related. And tecovirimat was approved in 2022. Yeah, to treat monkeypox. Tecovirimat, which blocks maturation of the virus and release of the virus from the cell. And studies were done. So this is the information on monkeypox, and very briefly I will cover cowpox. Edward Jenner used in a vaccine. Cowpox is also zoonotic, transmitted from animals to humans, and reservoir. Here are also rodents, can be cats as well, and usually milkmaids were infected very often from animals. Skin lesions are more hemorrhagic here, can be found on hands, on face. There is also fever, so this constitutional symptoms as well. Yeah, lymphadenopathy can be also seen here. So cowpox is not so common, but the last pox virus briefly to discuss for today is molluscum contagiosum. This is not related, genetically related to orthopox viruses like monkeypox, smallpox, cowpox. This is molluscum virus, another genus of pox viruses, and molluscum contagiosum has worldwide distribution. It is very common, and it leads to development of warts on the skin. Yeah, there's another virus we'll cover later, papillomavirus, leading to development of warts like this, and it is transmitted through skin-to-skin contact, direct contact, also through sexual intercourse, and we see these skin lesions on face, arms, in different parts of the body. The incubation period is long, 6 months, so virus infections epithelial cells and can lead to growth of epithelial cells and formation of the warts. And it is not a health issue here, more cosmetic problem. Yeah, usually we don't like to have some warts on the face, and it can be removed surgically or can spontaneously disappear for within 2 years. Yeah, regress spontaneously, and it can be seen in genital area as well, and sometimes it can be confused with the genital herpes as well. So it's not a huge concern, and it also leads to formation of umbilicated, so cup-shaped warts on the skin, but there can be very mild or no inflammation, so not much concern. Okay, so this is the next chapter, chapter 34 from Genomics Medical Microbiology. So, 20 minutes break and we'll have then tutorial. Okay, see you soon.